Babies cry a lot, especially during the first 5 months of life. In fact, a normal, healthy baby may cry up to 5 hours or more each day. Babies will cry the most at age 2 months, but have patience. After the age of 2 months, your baby will begin to cry less each week. Unfortunately, crying is the #1 reason babies are shaken or hurt by their caregivers. As a parent or caregiver, there will be times when you are tired and stressed, when your child cries for reasons you may not understand, and when you are overwhelmed to the point that frustration may lead to the injury of your child. Shaken baby syndrome, SBS, is a term often used by doctors and the public to describe abusive head trauma inflicted on infants and young children. Violently shaking an infant and blunt impact to a child's head can cause many serious and often fatal injuries. Shaken baby syndrome is not caused by gentle, age-appropriate play, such as bouncing a baby on a knee or rocking a baby, nor is it caused by short falls or CPR. All it takes is a moment of lost control and violent shaking by a parent, caregiver, or family friend for a child to become injured, become permanently disabled, or even die.
When you think of a baby, it's very different than an adult or an older child. It has a very large, heavy head, and that head is sitting on a neck that is very weak. You know that when you pick up a baby, you support the head because it doesn't have any strength in the neck. And the reason for doing that is to keep the head from flopping around. Inside of the head is a very soft brain. A baby's brain is about the consistency of unset gelatin. And if you make movement inside the cranial cavity where the brain can actually begin to move, that can cause portions of the brain, some of the actual structural elements of the brain, to tear. Those are the connections between the nerve cells. One of the ways that they can be easily torn is if the head moves very abruptly. And if you think of the action of shaking a baby where the head is being whiplashed back and forth, or if you do something to the baby's head to strike it and make it move, or if you took a baby and threw it, and in the head moving and then stopping very abruptly, you can cause motion of the brain inside the cranial cavity. If you think about a glass of water, that's a perfect example to kind of understand what happens inside of the baby's head. If you agitate and move rapidly the glass of water, you can make the water actually splash out of the glass because the container, the glass, is much more rigid than the water. The skull of a baby is much more rigid than the brain. If you move it very abruptly, you can cause a lot of inner motion of the brain, and that can cause bleeding over the surface of the brain. It can cause tearing of the brain itself. It can cause hemorrhages in the eye. It can cause enough damage to make the baby die. So it's a very serious thing.
Crying is the #1 reason why a parent or caregiver may lose control and shake a baby. Persistent crying creates frustration, stress, anger, and even rage. Shaking may seem less violent than hitting, but neither is appropriate. Shaking is child abuse.
Most experts believe that no one gets up in the morning planning to shake their baby, but the person responsible for the child loses control, even if only for a few seconds. Remember, your baby isn't crying to make you mad. Crying is normal and is one way a baby communicates. There are steps you can take to help you keep control when your baby won't stop crying and you feel frustrated. Remember, babies cry a lot. Try these ideas to help soothe a crying baby. First, check to see if your baby is hungry or needs a diaper change. Call your doctor if you think your baby might be sick. Try rocking, walking, or talking with your baby. Going for a ride in the car. Giving your baby a warm bath. Singing or playing a recorded lullaby or other soothing music. Remember, sometimes your baby will cry no matter what you do. It's really frustrating, but if you become too frustrated, it is perfectly okay to allow the baby to continue to cry. It's okay to walk away. Take a break. Lay your baby down on his or her back in a safe place or crib. Sit down, leave the room, take a deep breath. Do anything to calm yourself. Watch TV, listen to music, and then check on the baby. If you still feel overwhelmed, call someone you trust for help, such as a friend or relative. Day or night, it is far better to wake someone up than to lose control of your emotions with your baby. Never shake or hurt the baby. There will be times when someone else will be caring for your baby. There are some points you should discuss with caregivers.
Make sure that everyone who cares for your child knows about the dangers of shaking. Always let your caregivers know where you can be located and give them a phone number where you can be reached. It's okay for babies to cry, but don't assume that your caregiver knows that. Provide caregivers permission to call you anytime they become frustrated or angry. Be careful when choosing a caregiver for your baby. It is dangerous to leave your baby with anyone who becomes angry or loses control easily, demonstrates disregard for children, or appears to be under the influence of alcohol or drugs.
Parenting is very rewarding, but it can be stressful. Just remember, anytime you feel you may lose control, stop, place the baby in a safe place on his or her back, and walk away. Take a deep breath and count to 10. If necessary, take a time out and let your baby cry for a while. Take a break. Do anything to take your mind off the baby's crying. Call someone close to you for support, a neighbor, relative, or friend. Call your child's health care provider. There may be a medical reason why your child is crying. And above all, never shake or hurt the baby. Remember, babies cry a lot, and shaken baby syndrome can be prevented. This information presented will help you be a better informed parent and caregiver when dealing with stressful situations and all the other challenges of caring for an infant or child. Have a plan, make good choices, and share your knowledge with others to keep babies safe.